Stop. Before you roll over tonight and fall asleep the way you always do, you need to watch this. Because right now, millions of people are unknowingly destroying their health every single night while they sleep. Not from what they eat, not from stress, not from anything they do during the day, from the side they sleep on. And the scariest part? Most doctors never bring it up during checkups. It doesn't make headlines. It's not trending on social media. But behind closed doors, in cardiology offices, gastroenterology clinics, and neurology wards, physicians are watching patients suffer from conditions that trace directly back to one silent, nightly habit. I've spent years studying the relationship between sleep position and systemic disease. What I found shocked even me. There are 5 sleeping positions and side sleeping mistakes that are quietly wrecking your body, your heart, your brain, your gut, your spine, and even your face. And most people have no idea they're doing any of them. Now here's what's interesting. Some side sleeping is not the enemy. In fact, one specific side can actually protect your heart and improve your brain's ability to flush out toxic waste while you sleep. Sounds unbelievable, right? But one side, the one that most people default to, is a slow, silent disaster. By the end of this video, you'll know exactly which side is which. You'll know what's happening inside your body right now if you're sleeping the wrong way. And you'll know the simple fix that takes less than 30 seconds to implement tonight. But first, number 5 on our list is something almost nobody talks about. And when I tell you what it does to your face and your jaw, you'll never look at your pillow the same way again. Let's get into it. Number 5, you're sleeping on your right side, and it's quietly refluxing acid into your throat every night. Here's something your gastroenterologist wishes you already knew. Your stomach, believe it or not, is not centered in your body. It sits slightly to the left. And at the top of your stomach, there's a valve. It's called the lower esophageal sphincter. Think of it as a one-way door. Its entire job is to keep stomach acid down, where it belongs. Now, when you sleep on your right side, something happens that most people never consider. That valve, that critical one-way door, gets positioned below the level of stomach acid. Gravity is no longer your friend. In fact, gravity becomes the enemy. Acid slowly, silently creeps upward, into your esophagus, into your throat. Sometimes all the way up while you sleep, completely unaware. You wake up with a dry cough, a sore throat, a strange bitter taste in your mouth. Maybe a burning sensation in your chest that you blamed on last night's dinner. It wasn't the dinner. It was your sleeping position. A study published in the Journal of Clinical Gastroenterology followed patients with chronic acid reflux and found that those who slept on their right side experienced significantly longer acid exposure time compared to left side sleepers. We're not talking about a small difference. We're talking about acid sitting in the esophagus 4 times longer on the right side versus the left. Over weeks, months, years, that repeated acid exposure erodes the lining of your esophagus. It leads to a condition called Barrett's esophagus, a precancerous change in the tissue that lines your food pipe. And it all starts with something as simple as which side you curl up on at night. The fix? If you struggle with reflux, heartburn, or even just occasional bloating, try switching to your left side tonight. Place a firm pillow behind your back to prevent rolling over. Within a few nights, many people notice the difference immediately. But we're just getting started. Number 4, you're compressing your shoulder and building a chronic pain cycle you don't even know has started. Let me paint you a picture. Meet Daniel, 41 years old, athletic, no history of injury. He started waking up every morning with a dull, nagging ache in his right shoulder. Some mornings it was stiffness. Some mornings it was sharp enough to interrupt his sleep at 3 a.m. He went to a physical therapist. He got massages. He tried anti-inflammatory medication. Nothing worked because nobody asked him one simple question. Which side do you sleep on? Here's the biology. When you sleep on your side, whether left or right, your entire body weight presses down on that shoulder joint for anywhere between 4 and 8 hours. The rotator cuff, the bursa, the surrounding tendons, they're all being compressed under sustained load with zero ability to decompress. Your shoulder is not designed for that. Over time, that nightly compression restricts blood flow to the joint tissues. It creates microinflammation. It triggers something called impingement syndrome, where the tendons of the rotator cuff get pinched between the bones of the shoulder. And once that inflammation cycle starts, it's incredibly hard to break. Studies from the Journal of Shoulder and Elbow Surgery have linked prolonged side sleeping directly to increased rates of rotator cuff pathology, especially in adults over 35. And here's what makes it worse. Most people sleep directly on their shoulder with their arm tucked underneath them. That position cuts off circulation even further. You wake up with a numb arm and shake it off, but the damage accumulates silently, night after night. The fix? Use a thick, supportive pillow that keeps your head and neck aligned and takes pressure off the shoulder. Try hugging a body pillow in front of you so your top arm has somewhere to rest, reducing the forward pull on the shoulder joint. And if you can, alternate sides throughout the night. Daniel did this. Within 3 weeks, the morning pain was almost completely gone. 2 down, 3 to go. And number 3, this one involves your brain. Specifically, what your brain is supposed to clean out every night while you sleep, and what happens when it can't do its job properly. This one genuinely disturbed me when I first read the research. Number 3, you're blocking your brain's waste removal system, and the consequences are terrifying. Let me ask you something. Did you know your brain produces toxic waste? Every single day, as your brain works, thinks, processes, and functions, it generates harmful metabolic byproducts, proteins, cellular debris, and most dangerously, a toxic protein called beta amyloid. You may have heard that name before, because beta amyloid is the same protein that accumulates in the brains of Alzheimer's patients. It forms plaques. It suffocates neurons. It destroys memory, cognition, and personality, slowly, irreversibly over decades. And here's what should alarm you. Your brain has a built-in cleaning system specifically designed to flush this toxic waste out every night while you sleep. Scientists call it the glymphatic system. Think of it as your brain's sewage network, a series of channels that open up during deep sleep and flood the brain with cerebrospinal fluid, washing out accumulated toxins. It is one of the most extraordinary biological processes in the human body. But here's the critical part that most people never hear. Your sleeping position directly affects how efficiently that system works. In 2019, researchers at Stony Brook University conducted a landmark study using dynamic MRI imaging to observe glymphatic flow in different sleep positions. Their findings were extraordinary. The lateral position, side sleeping, showed the most efficient glymphatic transport compared to sleeping on the back or stomach. But not all side sleeping is equal. When you sleep on the wrong side or with poor spinal alignment, the glymphatic channels become partially compressed. Flow is restricted. Toxic waste, including beta amyloid, doesn't get flushed out completely. Night after night, year after year, the buildup begins. Now let me be clear. One bad night doesn't give you Alzheimer's, but chronic decades-long disruption of glymphatic clearance? Researchers believe it is one of the key contributing factors to neurodegenerative disease. This isn't fringe science. This is being studied at some of the most prestigious neurology institutions in the world, and it gets more personal than that. A 67-year-old retired teacher named Margaret came in complaining of brain fog. She wasn't forgetful enough for a dementia diagnosis, but she felt mentally slow, tired despite sleeping 8 hours, struggling to find words mid-conversation. Her brain scans showed early signs of amyloid accumulation. When we reviewed her sleep habits, she had spent 40 years sleeping flat on her back, completely unaware that her glymphatic system was running at a fraction of its potential. The fix? Sleep on your left side with a supportive pillow that maintains proper cervical spine alignment. This position has been shown to optimize glymphatic drainage and give your brain the best possible chance to clean itself every single night. Your brain works hard for you all day. Give it the conditions it needs to recover. But as alarming as number 3 is, number 2 is where things get deeply personal for most people. Number 2, you're slowly compressing your heart and your body is sending you signals you keep ignoring. Your heart sits slightly to the left of center in your chest. It is surrounded by a protective sac called the pericardium. And all around it, your lungs, major blood vessels, the inferior vena cava, the largest vein in your body, responsible for returning blood from your lower body back to your heart. Now picture sleeping on your right side for 6 to 8 hours. Your entire thoracic cavity shifts, organs press inward. And here's what cardiologists have been quietly concerned about for years. Sleeping on the right side places direct mechanical pressure on the inferior vena cava. That pressure partially restricts venous return, the flow of blood back to the heart. For a perfectly healthy young person, the body compensates. But for anyone with an existing heart condition, hypertension, heart failure, or even just a structurally enlarged heart, that restriction matters enormously. A study published in the Journal of the American College of Cardiology examined sleep position preferences in patients with congestive heart failure. The findings were striking. Patients instinctively avoided sleeping on their left side, not because it was harmful, but because left side sleeping made them more aware of their own heartbeat. It felt uncomfortable. So they defaulted to the right. But that default was quietly making their condition worse. Meanwhile, research from multiple cardiology centers has consistently shown that left-side sleeping reduces the mechanical load on the heart by freeing the inferior vena cava from compression and improving overall cardiac output during rest. Think about that. While you sleep, completely unconscious, your heart is either working harder than it needs to, or it's resting efficiently. The difference comes down to which side of your body is facing down. And the warning signs are hiding in plain sight. Do you wake up with heart palpitations, irregular heartbeat in the early morning hours, unexplained fatigue that no amount of sleep seems to fix? These can all be downstream effects of compromised cardiac rest, night after night, in a body that never gets to fully recover. One of my patients, a 55-year-old man named Robert, had been experiencing early morning palpitations for 2 years. His cardiologist had run every test. Everything came back borderline, nothing definitive. We changed one thing: his sleep position. Within 6 weeks, his morning palpitations had reduced by more than half. Sometimes the most powerful interventions are the simplest ones. 2 items down in this final stretch. But nothing we've covered so far compares to what's coming. Number 1 is the one that made me stop mid-research and sit back in my chair. It connects everything, your brain, your heart, your gut, your nervous system, into one single devastating pattern. And the terrifying part? It's the position that most people on Earth default to without ever being told otherwise. Number 1, you're sleeping on your stomach, and it is silently destroying your brain, your spine, your nerves, and your future. I want you to stop for a moment. If you are a stomach sleeper, or if you know someone who is, what I am about to tell you is the most important thing you will hear today, possibly this entire year, because stomach sleeping is not just a bad habit. It is a full-body assault that happens every single night, for hours at a time, while you are completely unconscious and unable to protect yourself. And the damage it causes is not superficial. It is not just a stiff neck in the morning. It goes deeper than muscle soreness. It reaches into your nervous system, your cardiovascular function, your cognitive health, and the long-term structural integrity of your spine. Let me show you exactly what happens the moment you roll onto your stomach. Your spine breaks its natural curve. The human spine has a carefully engineered design. 3 natural curves, cervical, thoracic, lumbar, that work together to distribute mechanical load, protect the spinal cord, and absorb the forces of daily movement. When you lie on your stomach, that entire architecture collapses. Your lower back hyperextends. The lumbar curve reverses. The intervertebral discs, the soft, gel-filled shock absorbers between each vertebra, get compressed asymmetrically. They bulge, they strain, and over years of nightly repetition, they begin to degenerate. But that's just the beginning. Your neck rotates to an extreme. For hours. Think about it. When you sleep on your stomach, you cannot breathe with your face pressed directly into the mattress. So you turn your head all the way to one side, and you hold it there for 4, 5, 6, 7 hours. Your cervical spine, the 7 delicate vertebrae that house the nerves controlling your arms, shoulders, hands, and much of your upper body, is now twisted to its near maximum rotation, under load, under sustained compression, for the entire duration of your sleep cycle. The joints in your neck are called facet joints. They are not designed for prolonged rotational stress. When you subject them to this night after night, they develop something called cervical facet syndrome, chronic inflammation of the joint capsule that causes deep, aching neck pain, reduced range of motion, and in severe cases, nerve compression. That tingling in your fingers when you wake up? That's not normal. That numbness in your arm? That's a compressed nerve root screaming for help. That headache behind your eyes every morning? That's a cervical spine under siege. Your nervous system never gets to rest. Here is what most people don't understand about the nervous system. Your body has 2 modes: sympathetic, fight or flight, and parasympathetic, rest and repair. During healthy sleep, your body is supposed to spend the majority of the night in parasympathetic dominance. This is when your heart rate slows, your blood pressure drops, your immune system activates, your cells repair, and your brain consolidates memory. Stomach sleeping disrupts this process at a fundamental level. The mechanical strain on the cervical spine directly stimulates the sympathetic nervous system. Your body detects the structural stress even while you're unconscious and keeps a low-level fight or flight response activated throughout the night. You spend hours in a state of subtle, chronic physiological stress. You never fully recover. You wake up exhausted, wired but tired, anxious for no reason you can identify, inflamed, foggy, running on a nervous system that never got to reset. This is not a theory. This is measurable. Cortisol levels in chronic stomach sleepers show elevated morning readings, consistent with disrupted parasympathetic recovery. Your stress hormone is high before your day has even started. Your brain is being starved of oxygen. Now layer this on top of everything else. When you sleep face down, your airway is partially compromised. The angle of your neck, the compression of your chest against the mattress, the restricted movement of your diaphragm, all of it reduces the efficiency of your breathing. Less oxygen per breath. For hours, your brain consumes 20% of your body's entire oxygen supply. It is the most metabolically demanding organ you have, and it is exquisitely sensitive to oxygen fluctuation. Chronic mild oxygen restriction during sleep, even without a formal sleep apnea diagnosis, has been linked in research to increased neuroinflammation, accelerated cognitive decline, reduced memory consolidation, and heightened risk of neurodegenerative disease. Remember the glymphatic system we discussed earlier? It requires deep, stable, oxygenated sleep to function at full capacity. Stomach sleeping sabotages that process from multiple directions simultaneously. Positional compression, oxygen restriction, sympathetic activation, and disrupted sleep architecture all converging at once. Your brain is trying to clean itself, and stomach sleeping is locking the door. The story that changed everything for me. I need to tell you about a patient I will never forget. Her name was Sarah, 52 years old, a kindergarten teacher. Sharp, warm, full of life. She came in with a list of complaints that had accumulated over a decade. Chronic neck pain, daily headaches, persistent fatigue, early memory lapses, and what she described as feeling like she was living behind glass. Present but not fully there. She had seen neurologists, rheumatologists, sleep specialists. She had been tested for autoimmune conditions, thyroid disorders, and early dementia markers. Every specialist found something. Inflammation markers slightly elevated, cortisol slightly high, cognitive scores slightly below expected for her age. But nothing definitive. Nothing that explained the full picture. On her intake form, under sleep habits, she had written 3 words. Stomach sleeper. Always. We started there. Over the following 3 months, we worked on transitioning her to left-side sleeping. We used a body pillow system to prevent rolling. We addressed the cervical dysfunction that had developed over decades with targeted physical therapy. At her 3-month follow-up, Sarah sat across from me and said something I think about often. I feel like someone turned the lights back on. Her headaches had decreased by 70%. Her fatigue had lifted significantly. Her neck pain, which she had accepted as permanent, was nearly gone. And she told me, for the first time in years, she was waking up feeling like she had actually slept. One habit changed, a life transformed. And that is exactly why this matters. Not to frighten you, not to overwhelm you, but to show you that sometimes the most powerful thing standing between you and better health is not a medication, not a procedure, not an expensive intervention. Sometimes, it is simply the position of your body in the dark. You made it. And that means something. Most people scroll past information like this. They see a headline, they feel a flicker of concern, and then they roll over, literally, and go back to the same habits that have been quietly working against them for years. But you stayed. You watched. You listened, and that tells me something important about you. You actually care about your health. Not just in theory, but enough to do something about it. So let's bring everything together. Because knowledge without action is just anxiety. And I don't want you to leave here feeling scared. I want you to leave here feeling equipped. Here is everything you now know. Number 5, right side sleeping and acid reflux. Every night you spend on your right side, gravity works against your lower esophageal sphincter, allowing stomach acid to creep upward into your esophagus. Over time, that repeated chemical exposure erodes the tissue lining your food pipe, silently, painlessly, until the damage becomes impossible to ignore. The fix is simple. Left side, firm pillow behind your back. Tonight. Number 4, side sleeping and shoulder compression. Hours of sustained pressure on a single shoulder joint restricts blood flow, triggers microinflammation, and sets the stage for rotator cuff impingement and chronic pain that most people spend years trying to diagnose. A thick, supportive pillow and a body pillow in front of you redistributes that load and gives your shoulder the space it needs to recover overnight. Number 3, sleep position and glymphatic brain cleaning. Your brain has a remarkable waste removal system that activates during sleep. It flushes out toxic proteins, including beta amyloid, the same compound linked to Alzheimer's disease. Left side sleeping with proper spinal alignment has been shown to optimize that system. Every night you sleep in the wrong position is a night your brain doesn't get fully cleaned. Number 2. Right side sleeping and cardiac stress. Your heart and the major vessels surrounding it are not indifferent to position. Sleeping on your right side places mechanical pressure on the inferior vena cava, restricting venous return and quietly increasing the workload on your heart during the hours it is supposed to be resting. Left side sleeping relieves that pressure and supports healthier cardiac recovery every single night. And number 1, stomach sleeping. The most damaging position of all. It collapses your spinal curves, rotates your cervical spine to its extreme for hours, activates your sympathetic nervous system, restricts your breathing, reduces oxygen delivery to your brain, and systematically undermines every restorative process your body depends on during sleep. If you are a stomach sleeper, this is the single most impactful change you can make for your long-term health. So what do you do starting tonight? The goal is simple: left side sleeping with proper alignment. Here is your exact action plan. Step 1. Get a pillow thick enough to keep your head and neck in a neutral position, not tilted up, not drooping down. Your spine should form a straight line from your skull to your tailbone. Step 2. Place a firm body pillow in front of you and hug it gently. This supports your top arm, prevents shoulder compression, and keeps your hips stacked so your lower back stays neutral. Step 3. Place a thin pillow between your knees. This one step alone dramatically reduces lumbar strain and hip pressure for side sleepers. Step 4. If you are a stomach sleeper, understand that this transition will not happen in one night. Your body has muscle memory built over years. Be patient with yourself. Start by placing a pillow beside you that makes rolling onto your stomach uncomfortable. Some people tape a tennis ball to the front of their sleep shirt. Whatever it takes to interrupt the pattern. Step 5. Give it 21 days. Research on habit reformation consistently points to 3 weeks as the threshold where new physical patterns begin to feel natural. The first few nights may feel strange. That strangeness is not a sign that something is wrong. It is a sign that something is changing. Here is the bigger truth. You spend roughly 1/3 of your entire life asleep. 1/3. If you live to 75, that is approximately 25 years spent horizontal. 25 years during which your brain is either cleaning itself or accumulating damage. Your heart is either resting efficiently or straining under mechanical load. Your spine is either recovering or slowly breaking down. Your nervous system is either resetting or running on a low-level stress response that bleeds into every waking hour. Sleep is not downtime. Sleep is the most active repair process your body runs. And for decades, most of us were never taught that the position of that sleep matters as much as the duration. Now you know, and now you can do something about it. One last thing before you go. I want you to think about someone in your life right now. A parent who wakes up stiff and exhausted every morning. A friend who complains of constant neck pain. A partner who sleeps on their stomach and can never seem to fully rest. Someone dealing with reflux, heart issues, brain fog, or chronic fatigue that nobody has been able to fully explain. This video could change something for them. Share it. Send it. Show it to them tonight. Because the most powerful thing about simple information is how far it can travel, and how many lives it can quietly shift in the right direction. And now I want to hear from you. Drop a comment below and tell me, what position do you sleep in right now? And after watching this, are you going to make a change tonight? I read every comment, and your answer might just help someone else reading below make the decision that changes their health. If this video helped you, like it, share it, and subscribe. Because every week I bring you the kind of health information that most people never hear in a doctor's office, but absolutely should. Take care of yourself tonight, because nobody else is going to tuck you in and fix your sleep position. That one is on you. Sleep well, sleep smart, and I'll see you in the next one.